What is your unconscious saying to your client's unconscious? We now know through neuroscience that we can help our clients to regulate through the mirror neuron system. Want to learn more about this? Come to this great 2-day workshop with Dr. Yuri Bergman, August 2nd and 3rd in New York. It has definitely helped my practice to thrive. Hope to see you there and check out this sample of Dr. Yuri Bergman.
If we, the short and the long of it for now is, if while we're doing therapy, EMDR therapy, if we constantly scan our own bodies, what we'll end up feeling is something in our bodies that is resonating what is going on in our patients. And this is something we used to also be scared of. For instance, all of a sudden, in the middle of a session, you felt like you're falling asleep. Or you felt like you couldn't sit in your own skin. And we used to try to distract ourselves. But what we're learning is if we kind of just pay attention to it while we're doing what we're doing without thinking about it, just notice it, just like what we ask our patients, is that it will begin to change in our own bodies and be lessened, and it's lessening because by us paying attention to it, we're containing it and detoxifying it in our own nervous system. And without thinking about it, what we're learning is that at a non-conscious level, our patients are noticing that. And if we kind of pay attention to them, we will see that they'll start coming down. So there's a resonance going back and forth. Our patients don't even realize it consciously. We basically, there's a conscious realization of what's going on. And in the past, when I was trained in the 70s, the aim was to take all of this and try to bring it to, a verbal level. So if, for instance, during sessions, if we found ourselves falling asleep, we would then say at some point to a patient, it sounds like when you were overwhelmed when you were a child, your nervous system tried to shut down. Neuroscience is kind of teaching us not even to get into that, just to kind of notice it. So you have this kind of resonance going back and forth. So we're modeling affective regulation at a non-conscious level.
Would you say that this is an additional boost in healing when doing EMDR therapy?
I think it is.
And why?
Because
what are we getting extra? Are we healing through our body language, our feelings, the brain connecting with our patient's brain? What's happening?
Here are basically at least the two major views on it. 5, 6, 7, 8, 9 years ago, when I wrote the first edition, then the notion was the brain's most remarkable growth is, well, certainly in utero, but once, we're born, those first 3 to 5 years, the brain basically 70% of it comes online, 65% of it comes online. And what we've learned in the interaction of caregivers and children is that there is a kind of a synchronization, sort of the parents, traditionally it's the mothers or the caregiver's right hemisphere with the baby's right hemisphere, because the child doesn't have the capacity yet to regulate. So that we've learned, and because today we have the machinery, you can basically scan the mother and a child at the same time. And what you see is that there is a synchronization that goes on there. So as we were learning this, the question was, is there any way to implement that in therapy? This kind of a vortex. So around 2010, 2011, neuroscientists were talking about that if we can resurrect this technique, which is called projective identification, which again is to just see what's going on in our own nervous system or body, then at that point the question was, maybe we can resurrect this kind of a vortex, this synchronized brain phenomenon. Today, with new research, basically that's really not much of a question. And as people have tried to do that and have been scanned and such, what we see is that there is a synchronization of two people together, therapist and patient. So it seems that we are there. By doing this, a lot of material that in the past would have been dissociated because it never came to a verbal level So either we had to go find it or it was missing. Now, this kind of resonance, what we're learning is that it actually does impact neuroplasticity, which is changing the wiring of the brain.
Wow.
And so the combination of understanding the brain, seeing the implication for treatment, which is in a sense, technically using projective identification, basically of us scanning our own bodies, that there is this other conversation that is going on at a non-conscious level, and that does, render any therapy, but especially EMDR, anything that's sensory motor, much more robust.
Wow.
And that's the paradigm shift.